The Minister of Health, Valasilo Pito Fanuatonga Mangatafito, said he and the ministry were unaware of any research conducted on the status of the Tupuoto Masiseme Ole Hospital, as reported by researchers at the Victoria University, New Zealand. The research findings were presented during the 4th Pacific Ocean Pacific Climate Change Conference, hosted by the National University of Samoa and SPREP last month. The research on Pacific carbon effect was conducted by Ryan Simpson, Robin Phipps, and Robin Skinner. Presenting on behalf of the researchers, Ryan Simpson, Master of Architectural Science on Decarbonization, used the hospital, the Tuia Tua Tupuota Masese Efi or Tate building, and some recently opened schools as examples of buildings that are not safe by way of their design and the way they were built. The research findings noted that the Tupuota Masese Ole Hospital was unsafe and unhygienic. In a recent media interview, the Director General of Health, Iono Dr. Keresoma, noted that the acute 7 and 8 of the Tupuota Masese Ole Hospital were the worst units with leakages and air conditioning issues. The findings by the Victoria University researchers was reported by Talamua in early June, and the state of the National Hospital was highlighted by several MPs in last month's budget session. On Tuesday this week, the Cabinet Development Committee or CDC, comprising cabinet ministers and CEOs of government ministries, inspected the state of the Tupuota Masese Ole Hospital. The Minister of Health later told Talamua that the inspection was crucial to confirm that the problems and issues raised in Parliament regarding the state of the hospital did not happen yesterday but have been there over the years since the hospital was opened 10 years ago. The minister also requested the ambassador for China to repair the hospital, as they not only built it 10 years ago, but they understand the structure and methods used when constructing it. The minister also noted that Samoa and China are celebrating 50 years of diplomatic relations next year.